Behind the headlines, immigration and health care. Congress and President Bush never did complete work on an immigration reform package and may take up that tough issue again next year. We, meanwhile, in a three-part series, are taking an in-depth look at three aspects of the impact of immigration on American families, on American wages, on America's health care system, and on the environment. In our second segment, we examine the impact on health care. Avon Park, Florida. Population 8,900. It's located in the central part of the state along the Citrus Belt.
Avon Park's a wonderful little town. The City of Charm was dubbed that many years ago by some of the founding families as a charming little place, and they put City of Charm on it. It has stuck.
But frustration, not charm, ruled in Avon Park this summer. This was the reaction from residents when the city council voted down an ordinance proposed by the mayor. It would have fined any business that hired illegal immigrants.
Instead of asking for help, they are in your face demanding that America allow them to break our laws, give them our money, give them our country. That's robbery.
There's a number of people that are just disgusted with the fact that the federal government and state governments have allowed it to get to the point that it has, to the point that hospitals and emergency rooms are in fact having to close their doors, and that the costs that are incurred by these facilities are being passed on to those of us who have medical insurance or do have the ability to pay for the services that we receive.
Avon Park is hardly alone. Frustration over taxpayer costs for immigration are brewing nationwide. The Wall Street Journal reports in 2006, 500 pieces of immigration-related legislation were introduced in state legislatures and town councils. Their goal? Cracking down on illegal immigration and sparing localities the cost of support services for illegal immigrants incurred in such fora as public education, public health, and public finance. Nowhere is the cost more evident than in the healthcare arena. Taxpayers have been galvanized by such things as routine 4-hour waits at Los Angeles emergency rooms and the threat of more hospital closings to pay increased taxes for health care for the uninsured. In 2002, LA voters approved a rare property tax increase to pump $168 million into county emergency departments and trauma centers.
Illegal aliens play a major role in our uninsured population. They occupy about 41% of the uninsured population. And so I think they are having a negative effect on the health care, and that's my concern.
Dr. Dennis Bassetti lives in Avon Park. He's a physician in private practice, as well as chief of staff at Florida Hospital in nearby Sebring.
We have 226 community hospitals in Florida, and 61 of them are losing money, and that's 30-some%.
Dr. Bassetti says since illegal and low-skilled legal immigrants rarely carry health insurance, they don't visit doctors for routine checkups. Instead, they go to emergency rooms, even for minor health needs. That makes their care much more expensive than it is for the average insured worker.
A fair percentage of ER visits are for minor things which could be taken care of at a walk-in clinic or a doctor's office.
Sometimes I go for the hospital for my teeth.
You go for your teeth?
Yeah, I go for your teeth.
What's wrong with your teeth?
Yeah, it's no good. Now they don't good. They still no good.
Those emergency room visits strain the ER staff as well as hospital finances.
It's a huge problem because what it does, it displaces ER services from people who are more sick, and they expect and deserve the same care for minor illness that someone who's having a heart attack does.
Some public health experts say massive immigration, particularly from poor nations, is reintroducing diseases to the U.S. population that were eradicated years ago.
You know, there are diseases in third world countries that we have conquered. Certain kinds of hepatitis, for example, and TB is a large problem that we haven't heard enough about. Right here in this county, some of our Mixtec farm workers had multi-drug resistant TB, and that's the kind of TB that's transmitted just by breathing.
The reason immigrants, legal or illegal, don't have health insurance is not so much a function of their legal status. This is a common mistake. Illegal immigrants overwhelmingly have very little education. About 60%, we think, have not even completed high school. Another 20% have only a high school degree. Now, the modern American economy doesn't offer people with that educational profile a lot of opportunities, and they typically work at jobs that don't pay much. As a result, they don't get health insurance, and their very low incomes mean, regardless of legal status, that they can't afford to buy it on their own. And that's why a lot of people point out that there's a high cost to cheap labor.
Steve Camarota's Center for Immigration Studies, which advocates for limits on immigration, estimates state and local governments spend some $4 billion a year to provide health care to illegal immigrants nationwide, and the federal government another $6 billion for a total of $10 billion. The Florida Hospital Association reports it cost $40 million in 2002 to treat non-U.S. citizens in that state at its member hospitals, the latest year for which such statewide figures are available.
If they go to the hospital and incur a charge, then the hospital has to pass those charges on to the rest of the population. The hospitals are making up the shortfall by passing on the charges to people who can pay and to insurance companies, but there comes a point when enough patients will complain about paying $100 for an aspirin, and then it remains to be seen what happens at that time.
Immigrants' rights groups want agricultural employers to pay for health insurance for workers, whether legal or illegal. But employers argue there are two problems with that. First, they say they pay just as much or more than other American employers who also do not routinely offer health care to low-paid workers. Ray Royce represents a Florida citrus growers group, one of whose member farmers told him recently,
folks that were harvesting for him were making about $9.50 an hour. That's significantly more than the folks that are working in a McDonald's or Walmart are making. I think they're starting them at $6.50 or $7. So I'd kind of argue with the premise that they're being paid more.
The second issue is farmers often hire workers they think are in the U.S. legally, but who turn out to be illegal immigrants. The document forgery industry has made it almost impossible to tell valid documents from forged ones.
Let's just assume the fictional character of Jose Lopez. He comes to me and says, I'd like to work, and I say, fine, and I would sit down with him, and there's a certain amount of documentation that he or any other person, white, brown, or black, is supposed to provide that says that they are legally entitled to work in this country. He provides me the forms as laid out by, the federal government. Once I have those forms, they, appear okay to me. Quite frankly, I'm not allowed by federal law to ask him to verify the authenticity of those forms.
A federal law called the Emergency Medical Treatment and Active Labor Act, or EMTALA, bars hospitals from refusing to treat patients regardless of their ability to pay or their citizenship status, and penalizes hospitals severely for breaking that law.
Penalties range from $50,000 up per offense, per doctor, or per hospital, and the hospitals can also suffer something called the Medicare kiss of death. And that means if they break this law to a sufficient degree of severity, they could lose their Medicare reimbursement number, and their Medicare funds would totally dry up and they would go bankrupt.
The Federation for American Immigration Reform, an advocacy group, reports 1 in every 4 uninsured people in the United States is an immigrant. Immigrants, legal and illegal, who arrived between 1994 and 1998, and their children accounted for 59% of the growth in the size of the uninsured population during the last 10 years. Teodoro Alvarado says when he was growing up as the child of migrant workers, his family had little or no medical insurance.
Sí, por nosotros, pero no cobraban mucho.
He says they covered the cost, but it wasn't expensive back then.
No puedo pagarle los míos, menos los otros.
He says he can barely cover his expenses, much less an illegal's expenses.
Tiene su gobierno.
He says he doesn't think that we should have to cover their expenses, that their government should help cover the expenses.